Hello, my name is Vivian Duggan. I am an Associate Professor in Equine Clinical Studies in the UCD School of Veterinary Medicine, and I'm the current President of the Veterinary Council of Ireland. I'm pleased to welcome you to the Veterinary Council of Ireland webinar on mental health and well-being within the veterinary professions. While the veterinary professions can be stimulating and rewarding in equal measure, they can also be very challenging at times. We know from our own experience and from research that there are high levels of anxiety and stress within the veterinary professions. Veterinary professionals are faced with a unique set of challenges, including complex caseloads, challenging clients, and long and unpredictable working hours. Veterinary professionals need to be in the right frame of mind to make effective clinical decisions and maintain good working relationships with their clients and colleagues alike. It's also important for veterinary professionals to learn to enjoy some downtime away from the work and the practice, and to be fully present for family and friends in order to maintain a sense of balance and equilibrium in their lives. The Veterinary Council of Ireland has produced this webinar in an effort to assist and support the health and well-being of its registrants, to help raise awareness of this important topic in an effort to equip all veterinary professionals with a series of practical guidance and supports to help minimise stress, enhance their well-being and support them in their practice of veterinary medicine and veterinary nursing. Throughout this webinar, you will hear from a number of speakers, including Dr. Margaret O'Rourke, a forensic clinical psychologist and the author of the Safe Vet Smart programme. Margaret will briefly discuss the aims of the Safe Vet Smart Handbook, a practical guide for managing stress and well-being within the veterinary professions. Seamus McManus, a retired veterinary practitioner and Veterinary Council of Ireland Council member. Seamus will discuss the normalisation of anxiety, stress and challenges associated with poor mental health within the veterinary professions. Seamus will share some insights from his own experience of working as a vet and a practice manager. Cleona O'Connor is a postdoctoral researcher at the National Suicide Research Foundation. Cleona will present the findings of the Veterinary Council of Ireland NSRF survey into mental health and well-being within the veterinary professions. Dr. Philip Dodd, clinical advisor of the National Office of Suicide Prevention, will discuss research findings and the supports available to assist veterinary professionals. David McKeown of Vet Support Ireland will discuss Vet Support Ireland and the supports available to assist veterinary professionals. Emma Tobin is a veterinary specialist and chairperson of the Irish Veterinary Benevolent Fund. Emma will discuss the Irish Veterinary Benevolent Fund and VetLife, which is a 24-hour free phone telephone support service. Rachel Brown is a mixed animal vet and the Deputy President of the Veterinary Council of Ireland. Rachel will share her perspectives as a vet in practice and her tips for managing health and well-being within the veterinary professions. Finally, Dr. Ailish Nireen will close the webinar with a discussion of the importance of looking after yourself and your colleagues. I hope that you will find this webinar to be meaningful and engaging and can directly apply some of the guidance in your practice of veterinary medicine or veterinary nursing.
In 2020, the Safe Vet Smart programme was designed, and this is a practical and complete guide to stress management and resilient techniques. The primary goal is to help you manage stress and prevent burnout while optimising your resilience, your stretch factor, if you like. And it has a number of targets. The idea is to teach you a number of skills that will protect you or inoculate you against the worst of the stress within the profession and the practice. So there are skills like taking the psychological temperature down, reducing stress, reducing anxiety, increasing flexibility and coping, increasing emotional fitness and emotional intelligence, increasing resilience and preventing burnout by helping you to stretch and be flexible with the stresses that you face. So Safe Vet Smart will help you by providing a simple, evidence-based, so it's not don't worry, be happy, it's all stuff that works to help you enhance your joy for practice and to have action steps, tools and resources to help you improve well-being, coping and resilience. And there are a number of benefits then to you and your practice if you address well-being. And we'll be coming back to these. You'll get lots of examples in this webinar of how to do that, the benefits of it, and how it actually works in practice, different types of practice. So thank you for listening, and I hope you find the Safe Vet Smart intervention of use and benefit in your practice. Thank you very much.
Hello, my name is Seamus McManus. I've been a council member since 2016. I'm a retired veterinary practitioner. I was in mixed practice for about 43 years, with the maybe latter 10 years focused more on small animal. I was in partnership for about 39 years and managed the practice for probably about 30 years, not always officially, but did most of the management over that period of time. So I have plenty of occasions and causes for plenty of hassle and stress over that period of time. And I think it's not unusual in most practices, in most occupations, and indeed none, to meet stress in everyday life. So the topic for me today is normalization of anxiety, stress, and other challenges that affect mental health within the professions. And there's a tail on that title that says it's okay to ask for help. Before I go on, I'd say it is okay to ask for help. It's important to ask for help. Very good to ask for help if we think we need it. And that can be from your own immediate family or workplace colleagues, or if things are a bit more difficult, professional help is readily at hand. Normalizing stress, I think that word means that, it's something to expect. And I think, going back over, history, there's plenty of references to difficult times in life. Referred to often in prayer and books and everything else. There's a reference in prayer, I remember, to mourning and weeping in this valley of tears, a prayer that goes back to 1,000 years. There's also references to President Abraham Lincoln having difficulties with mental health issues. In fact, his law partner said that he dripped melancholy. James Herriot, who wrote many books about veterinary life in rural England and Yorkshire, he used writing to help him with mental health issues as well. So it is normal. Life itself is a challenge. There was a certain suggestion that it's a trial, that it's not a walk in the park, and we can expect challenges and issues to emerge, unexpected issues, both in the workplace and personally, on a daily basis. In relation to the workplace, I'm speaking here from experience. I have no particular expertise in this subject, but apart from my expertise, I've lived the life of a vet for, as I say, over 40 years. So issues that did emerge at work were things that used to stress us out a lot were things like unexpected outcomes, where you got maybe sudden death in an animal that came in for a routine surgery. And these things were very stressful because the expectation the client had was now completely unmet. And by the time you gathered yourself together and examined what you had done, whether you'd made a mistake or who was at fault for this, and then got around to ringing the client, and maybe when I was younger, trying to make excuses for what happened, but later becoming as frank and honest as I could with the client, all that was extremely difficult, Very, very difficult. I think it was the most traumatic thing that could happen in a veterinary workplace. And then there was other issues like staff issues in the workplace. These were stressful. Disagreements between partners on policy or the way forward. Maybe work, when you go out and you have a day's work planned and you start to get calls thrown in on top of that and clients are delayed. There was a lot of issues that were, quite stressful, that would upset your day. And then on a personal level, issues like maybe family strains at home. Why weren't you home? You're gone all day, you said you'd be home. All these kind of things increased the pressure, I suppose, on relationships. There could be health issues. There might be issues with the kids. There could be sometimes confidence issues in your own ability, in the way you dealt with people, in your people skills. All those things, I think, add up to make life just very challenging from time to time, and you just wonder, are you being overrun with negative things? So, I suppose then we know these issues are there, so it's about, I suppose, setting your expectations, knowing that life is not a bed of roses, these things are going to happen, and then building up your own ability to cope. And I think when you have children as well, these are one of the things that you try and do, maybe make sure that they can cope with the challenges that life throws at them. The way I used to try and cope with some of these things is I would start with a perspective, I think, and say, there's plenty of evidence there that these challenges are normal. And the other thing I found took great comfort from was that because I'm here at this time in the universe, it means that my ancestors have survived and that I have a little bundle of resilience within me, if I can tap into it, that will help me when times are challenging. Reassure me, say that there is a way out, see the bright side. So I start from that perspective. And then on a daily basis, I would try, most days, try and build up that mental resilience, that fitness, so that I can actually deal with things when they arise. And that would be things like maybe mindfulness, meditation, could be prayer, whatever works for you, acceptance. These things nurturing a kind of strength of spirit, as the Desiderata prayer says, in times of misfortune, because misfortune will arise in some shape or form. The other thing then I would try and do is, reflect on and make a list of the good things in your life, and I try and start with and remind myself of how good the relationships are around me, because we depend on these. So the things that at one time might have been very attractive in a person, they can wane. Their attractiveness can wane, and you can actually begin to focus on the negatives, the things that bother you about a person. And that's a dangerous and destructive attitude, I think. So trying to do that on a regular basis is important. The other thing I think is trying to give a bit more than we get. Try and give more than you get paid for. I mean, that is inclined to give us a very good feeling of wellness and well-being in ourselves, that we're doing something good for others. Working on friendships is important, and I think in veterinary particularly, but probably in any self-employed or busy occupation, it's easy to let friendships drift. So I think working on those, getting a different perspective, friends can lift you up, get you out, those things I find were essential as well, definitely helpful. Worrying about things, sometimes we worry about things that we can't do much about, so I try and put those to one side, worry about the things I can do something about and do something about them. So the other thing I found very beneficial is listening, develop listening skills to try and understand the other person's point of view. Then if you actually acknowledge that you've heard what a person is saying, their tone changes and say, oh, do you think that's a good idea? And you have a much less fraught conversation. So within the practice, that was good. The other thing I think was within the workplace, the management skills, important to improve those, because where there's a group of people working together, if the management skills are bad, it can create terribly difficult workplace situations. So that's a good thing. And the other thing I would say to practice owners is it's important to employ, I would think, veterinary nurses, because they can greatly improve the workplace and take a lot of pressure off the veterinarian. They feel fulfilled, and I think that can be a benefit to everybody. And I think finally, hope for the best. Live in hope. Be optimistic where you can. And these things you can cultivate. So try and be optimistic. And if you do feel that you're getting under pressure, talk to your colleagues in the workplace, share your troubles, talk at home with your family, and if you have to, get help from a professional, you'll feel an awful lot better. I'd just like to say that the Safe Vet Smart Book by Margaret O'Rourke is a great resource. While there are many others, this is very easy to access, and I found it particularly beneficial over the last couple of years during the pandemic. So, thank you very much. I wish you the best in your personal and in your work life. Thank you.
Hello, my name is Cleona O'Connor. I am a postdoctoral researcher at National Suicide Research Foundation, and we conducted a survey with the National Office for Suicide Prevention to understand the mental health needs of veterinary professionals in Ireland. And I'm going to give you a brief overview of some of those findings today. To give you a brief background, we know from international literature that veterinarians experience higher levels of anxiety and depression symptoms than the general population, and that veterinary is a high-risk group for suicide. There is currently very little research on the mental health of veterinary nurses. This, coupled with significant risk factors such as access to lethal means, familiarity with death and dying, and suicide contagion, give us some concern to learn more about how we can support veterinary professionals. We are aware of several occupational stressors which are specific to the veterinary profession, such as long hours, workload, work-life balance, fear of litigation, financial issues, client expectations, working with euthanasia, and fear of making fatal mistakes. We in the National Suicide Research Foundation and the National Office for Suicide Prevention wanted to learn more about the mental health needs of veterinary professionals and how they may be best supported in terms of their mental health. To do this, we conducted an online survey with registrants of the Veterinary Council of Ireland. 3 emails were disseminated to VCI registrants over a 4-week period, and we received 747 responses, which represents 18% of veterinary professionals. We asked a range of questions on demographics, stress levels and factors, resilience, burnout, help seeking, depression and anxiety, suicide and self-harm, mental health knowledge and literacy, and stigma. We used standardised measures of some of the mental health indicators which have been internationally validated, and this allows us to categorise responses for depression and anxiety based on what would be considered low, called normal, mild to moderate, called borderline abnormal, and severe, called abnormal. As you can see in the graphs here, the female respondents closely matched the profile of female veterinary professionals registered with the VCI, whereas we had significantly fewer male veterinary professionals in the 20 to 29 category, and the more male veterinary professionals in the 50 to 59 category as compared to registrants of the VCI. It is important to bear this in mind when interpreting some of our findings. 67% of respondents were female and 33% male. 72% were veterinarians and 26% veterinary nurses. 30% of respondents were in the 30 to 39-year-old bracket, with just over 20% in the 20 to 29-year-old bracket. 20% of respondents were in the 40 to 49-year-old bracket, and we see that drop to approximately 15% in the 50 to 59-year-old bracket, 10% in the 60 to 69-year-old bracket, and 2% in the over 70s group. Most of the veterinary nurses who participated reported that they were employees, while approximately 55% of the veterinarians reported that they were employees. The others being in managerial roles, self-employed, shareholders or partners. For the purpose of analysis, we created 3 groups. Veterinarian employees who reported that they were veterinarians and employees. This equated to 39.6% of respondents. Veterinarian managers who were 34% of respondents, and veterinary nurses, who were both working as nurses and in managerial roles. This equated to 26% of respondents. Over half of our respondents work in practices with 10 or more employees. 27.5% work in practices with 5 to 10 employees, and 17.5% with less than 5 employees. Approximately half of the respondents reported spending more than 50 hours at work. 50 plus hours were reported by 72% of vet managers, 53% of vet employees, and 13% of vet nurses. The majority of the respondents worked in companion and mixed practices. It is important to note significant gender and age differences in terms of mental health among this group before interpreting the upcoming findings. Females displayed significantly higher anxiety, depression, and stress than males. Anxiety, depression, and stress was significantly higher for younger respondents than older respondents. Veterinarians reported an average stress level of 7 out of 10, and there were no significant differences between occupational groups when controlling for age and gender. Top stressors were reported as follows. For veterinarian employees, work-life balance, long working hours, and out-of-hours care were top stressors. For veterinarian managers, work-life balance, long working hours, and out-of-hours care were also top stressors. For veterinary nurses, work-life balance, long working hours, and salary were significant top stressors. As noted earlier, we used a standardised measure of anxiety, which allows us to categorise responses. We found that 35% of respondents were in the normal range for anxiety, 23% in the borderline range, and 43% in the abnormal range. A significant difference was observed between occupational groups, with veterinarian employees and veterinary nurses displaying significantly higher anxiety than veterinarian managers. However, this finding was not observed when controlling for age and gender. Looking then at depression, 61% of participants presented in the normal range, 23% in the borderline abnormal range, and 16% in the abnormal range. There was no significant association observed between occupational group and category of depression. 5% of our respondents reported that they had ever attempted to take their own life. This was a significant difference here between occupational groups, where 10% of veterinary nurses reported this, 4% of veterinarian employees reported this, and less than 1% of veterinarian managers reported this. Of the 5% who reported this, 8% of those occurred within the last year. In relation to deliberate self-harm, 12% of the sample reported having engaged in deliberate self-harm, and this figure is comparable with the National Household Survey conducted in 2020 with the general population in Ireland. Again, we observed high figures here for veterinary nurses, where 25% of veterinary nurses reported to have ever engaged in deliberate self-harm, 10% of veterinarian employees reported this, and 4% of veterinarian managers reported this. Of the 12% of veterinary professionals who reported to have engaged in self-harm, 37% of those reported that this occurred within the last year. We asked our respondents an open-ended question about what helps them to look after their mental health. The most commonly reported amongst the responses involved engaging in activities such as sport, exercise, hobbies, spending time outdoors. Social support then was the second most commonly reported way of looking after mental health, especially talking to family and friends, actively employing coping strategies such as goal setting and relaxation methods was the third most commonly reported method. Other methods that were reported included taking time off, spirituality, seeking professional help, spending time with pets, and having a good diet. We also asked an open-ended question on how veterinary professionals would like to receive support for their mental health. Veterinary professionals reported that they would like increased access to sources of help, including professional help of therapists and counsellors, and more workplace-based support in the form of support from management or peer support. Practical support such as increased time off, decreased on-call hours, and financial support to seek help were also commonly reported. Methods to receive support included increased psychoeducation and talking therapy online or by phone. Approximately 5% of respondents reported that they would like to see increased awareness and less stigma around mental health in the workplace. Overall in this survey, we observed that anxiety levels were high amongst all occupational groups. Work-life balance was a significant stressor. Veterinary nurses have a higher prevalence of poor mental health, self-harm and suicide. And this may be driven by the age-gender profile of the group. In other words, being young and female, which we observed was a significant risk factor for poorer mental well-being. Activities and social support are commonly used by veterinary professionals to mitigate distress, and there is a desire for increased access to support and education around mental health. Going forward, to protect veterinary mental health, findings from this survey and from the literature suggests that reducing risk factors such as workplace stressors, stigma, overworking, job insecurity, exposure to physical risk, toxic management styles, discrimination, and developing robust mental health policies, as well as practicing fair procedures for resolving grievances, training managers to identify and intervene in employee psychosocial difficulties, increasing access to psychosocial support and providing suicide prevention training to the workplace may help to improve the mental health and well-being of veterinary professionals. For more information, please email me on the presented email address. I encourage you to visit the support page on the VCI website for a list of support services available to you. Thank you.
Hello everybody. On behalf of the HSE and the National Office for Suicide Prevention, I'd like to thank the Veterinary Council of Ireland for inviting me to speak as part of this very welcome mental health and wellbeing webinar. We in the National Office for Suicide Prevention have been very happy to collaborate with the Veterinary Council of Ireland and our colleagues in the National Suicide Research Foundation on a recent survey of your members' mental health and wellbeing, and I know my colleague Dr. Cliona O'Connor has already presented some of the findings of that survey to you as part of this webinar. The focus of my talk for the next 10 minutes is really broadening out the discussion on the available mental health services that we have as part of the HSE. I'll also go through maybe some of the psychosocial responses that have been developed as part of the HSE's mental health, wellbeing and specialist services provision as part of the response to the COVID-19 pandemic. Then I'd like to move on to specifically talking about some free available suicide prevention training and then also some brief details on additional information and supports. So firstly, in Ireland, our mental health services are delivered and designed in keeping with national mental health policy, and our current national mental health policy is called Sharing the Vision. This is a whole population, whole of government, ambitious policy that was launched in June 2020 that very much has an ambition to improve the mental health and wellbeing of the whole population. So as a result, services and supports and innovations are designed with the whole population in mind. And this is represented on this slide by this inverted pyramid. And the concept around this inverted pyramid is the fact that the whole population should be provided with mental health and wellbeing supports, and that's represented by the broadest part of the pyramid. In addition, campaigns such as stigma reduction in mental health are also important general mental health and wellbeing innovations. Then as individuals require or are seeking more information or support, they move down through the various tiers of support as indicated by the pyramid. So the next level would be self-agency. So this would be where you do some self-directed information gathering or even self-directed mental health and wellbeing improvement. Next would be people-to-people supports. So as you need more information or support, that is best placed in person-to-person support. And then the next level is moving more into the professional area of mental health support, so that's at primary care or in the voluntary and community sector. And then moving up to specialist mental health services if you are presenting with a significant mental health problem. So that is the basic footprint in which we're working to develop a whole population, whole of system mental health service offering. And maybe to give an applied example of how we in the HSE tried to respond and are responding to this current COVID-19 pandemic, the HSE has worked with a number of non-governmental partners to develop an inverted pyramid type response to the mental health and well-being challenges that this pandemic is presenting. So if you remember, the broad part of the pyramid is more around mental health information and support. So we have relied significantly on our website yourmentalhealth.ie and the associated helpline 1800 111 888 as really the entry portal for trusted information around mental health and well-being and targeted information about the impact that the COVID-19 pandemic is having on mental health. Then as you move down the pyramid, we developed and quickly provided free of charge to the general public some self-directed supports such as stress control, online programs, minding your wellbeing programs and other programs hosted by a third-party agency called SilverCloud. Then again, as we moved down through the pyramid, we developed supports moderated by health professionals and launched just at the beginning of the pandemic the National Crisis Text Line that's called Text About It 50808. And this is an accessible format for individuals presenting with distress and difficulty or wanting specific information around their mental health worry, where they engage in a real-time text conversation with a mental health professional. And then moving on up and through the primary care level through partners provided through My Mind. So this is a counselling support service that's provided free of charge to members of the public presenting with mental health difficulties associated with the pandemic. Then other services and supports that we developed aligning with that whole of population approach. So obviously Jigsaw is our youth mental health clinic service provided to young people up to the age of 25. So it also developed accessible and adapted mental health offerings for the relevant part of the population. And then in specialist mental health services, given the infection control restrictions that the pandemic has imposed on us, many clinical appointments, mental health clinical appointments, were transferred, if appropriate and if possible, to a video format through the Attend Anywhere platform. And the take-up of this by members of the population attending specialist mental health services has been really positive. Obviously, face-to-face appointments and face-to-face mental health supports continue, but where appropriate and where safe, an alternative video interface is suggested. So then, maybe moving forward into the suicide prevention training. So this part of the talk is very much aligning with some of the findings that Dr. O'Connor presented earlier in this webinar. And we know in Ireland that the only way we can reduce levels of suicide is through a whole population, whole of system approach. And we have in Ireland a suicide reduction strategy called Connecting for Life. This was launched in 2015 and has recently been extended up to 2024. And as part of it, it has a whole range of actions that we know, based on international best practice and evidence, are associated with impacting on the reduction of levels of suicide. And one of the key parts of whole population suicide reduction strategy is the provision of suicide prevention training. And the office to which I work with and provide clinical advice to is the National Office for Suicide Prevention. And we are tasked with providing free, whole population, multi-layered suicide prevention training, and indeed all of this training is potentially available to members and registrants of the Veterinary Council of Ireland. So if you can just come with me through this particular slide, at the very bottom of the pyramid is our entry level training and support, and this LivingWorks Start training was developed by NOSP last year as a 90-minute online training offering that very much is designed to provide those attending with a greater level of awareness of suicide, of the signs and maybe presentations of colleagues, friends or family members who are presenting in mental distress, where self-harm or suicide may be a feature of it. So this 90-minute online training is available free of charge, as I've said. Then as we move towards maybe individuals whose role or whose level of interest suggests that they want more detailed level of training, the next level of training provided is Safe Talk, which is a 3.5-hour face-to-face training offering that's provided all over the country, and I will give details as to how members can potentially access this training. It's a 3.5-hour face-to-face training offering that very much focuses on building on the training provision that would be provided under LivingWorks Start, but very much introduces a greater level of competence around individuals' alertness to maybe colleagues, friends or family members who are potentially presenting with concerns around self-harm or suicide. And then maybe as one's role or one's job involves a more response or intervention potential to prevent suicide, 3 additional more intensive training offerings are provided. So Assist is a 2-day face-to-face training program that very much is provided to what we would describe as designated gatekeepers. So for example, if you're working in a healthcare setting, obviously that potentially exposes you as part of your role and your work to individuals with mental health difficulties where suicide or self-harm may feature. So this may well be more appropriate for that level of interest and responsibility. And in the same way as understanding self-harm and suicide bereavement are more specialist training offerings. So if you do want more information on this suicide prevention training, obviously you can link to our website. The detail is given on the slide. And we have across Ireland a network of resource officers for suicide prevention. So in every county in the country there are local resource officers for suicide prevention, or ROSPs, who are really there to assist you in coordinating any local training that you're interested in developing based on the offering that I and the detail I provided in the previous slide. So if you go onto our website, there you will find the contact details, the name and contact details of the relevant ROSP who will assist you with your suicide prevention training needs. And then just briefly, as part of the National Office for Suicide Prevention's role in supporting the implementation of Connecting for Life, our national suicide reduction strategy, we provide a lot of additional funding and supports to organisations that are feeding into the 69 actions that are required for implementation as part of our suicide reduction strategy. And then just briefly to maybe flag again, the yourmentalhealth.ie website is a dynamic part of the HSC's website that identifies and provides information on mental health topics, but also key, very importantly, signposts, and gives information to appropriate services. And again, to remind you, the associated helpline number is the 1-800-111-888, where if you call that, the individual on the call will provide you with information on next steps for whatever supports or information you're looking for with regard to mental health. And just finally, there are contact details. If you have any questions, you can email us into info@nosp.ie, and you can obviously follow us on social media as detailed there. Thank you very much.
Hi, it's David McKeown here. Thank you for watching this section on support within the veterinary profession. I'm going to talk about Vet Support Ireland, and Emma is up next. We'll talk about the 24/7 emergency support provided through VetLife. Like many professionals, we're often under pressure and can feel stressed by the catalogue of important decisions we're expected to make every day, every hour, every 10 minutes. Vet Support Ireland was set up a few years ago in response to a need within the profession for peer support for colleagues who are stressed for whatever reason. We're not counsellors or therapists. We belong to your profession and we can relate and empathise with whatever you're going through. We've been there before. We've been there already. We've been trained to listen. We're trained to act as peer supporters and to provide a coaching service to anyone who contacts us. We're a group of volunteers, 7 vets and 2 RVNs. And whilst it's impossible for us to provide a 24/7 service, we promise to respond promptly, usually within a day, to contacts made via our website, vetsupport.ie or vetsupport.me. We do not have a vet support telephone number. We often receive contacts from vets or nurses who have been signposted from elsewhere. For example, Vet Life, where a degree of continuity is thought to be helpful, and essentially we form a short relationship with each caller to guide them through. Our support is completely confidential. We guarantee that, and we know how vitally important it is for you to know that your situation is never discussed with anyone outside of that private conversation. So why would you contact Vet Support Ireland? If you're feeling highly stressed, really anxious, overwhelmed for whatever reason, or even on the verge of wanting to run away, we're happy to talk to you. We'll take you through a process that will help you calm down, and in so doing, we'll assist you regain a rational perspective on what's going on. At that stage, we'll take a structured approach in a supportive environment to help you explore your options and the ways out of the particular issue you're facing at that time. We've now had several years' experience helping colleagues, and we've received numerous testimonials from those colleagues telling us that we've helped stop their minds whirring needlessly. We've helped with assertiveness, or we've assisted a colleague make what they felt was the right decision. The reason for the calls are varied. It can relate to work pressures, being time poor, being exhausted, issues or conflicts with bosses or colleagues, confusions about career choices. It can be pressures outside of work, which may or may not be impacting on work. Relationship issues with partners, kids, parents, financial worries, addiction worries. The list is endless. So how would you contact Vet Support Ireland? As I said, we don't have a phone line. Contact is made via the website, vetsupport.ie, vetsupport.me. A general contact or inquiry can be made, which allows you to send an email to the organisation, and the vet or nurse on duty that week will contact you to arrange when and how best to conduct a conversation. Those conversations are often by phone, but more frequently by WhatsApp, Zoom, or FaceTime. Occasionally, communication is via email, but that is significantly less effective. On our website, you can also view who the peer supporters are, and you can read their short biographies. And on that page, that allows you to choose who you might prefer to talk to. Sometimes you may decide who you don't want to talk to. That's absolutely fine. You choose based on the stage of career, or you can choose based on the stage of career, someone who looks old and wise, someone who might be closer to the stage in the profession that you're in. It could be a species interest vet that you want to talk to, small animal, large animal, could be a locum, could be a nurse you wish to open up to. You've got choice. So instead of a general email to info, it's perfectly okay to email the supporter of your choice. And as I've already said, no one except the two of you will ever know the conversation took place. We accept that we all have mental health. We require some stress in our lives to function. We all need a little bit of stress. But we need to control it. We need to learn to control it. And Vet Support Ireland teaches you how. I'll now hand you over to Emma. Thank you.
Thanks, David. And thank you all for taking the time to listen to me today. Firstly, I'd like to start with a big thank you to the Veterinary Council for their initiative in setting up this webinar. And also, without sounding cliched, I would like to let you know that on behalf of the Irish Veterinary Benevolent Fund, to say that if you need us, if you need support for well-being or financial support, or both of them, we are absolutely there for you. A little bit of history. The Irish Veterinary Benevolent Fund was established in 1982 with the purpose of providing financial and other support to veterinary practitioners and their families. But recently, the Irish Veterinary Benevolent Fund converted to a company limited by guarantee, as this is the preferred format for registered charities. And we have also extended our remit to include veterinary nurses and their families under the new constitution. The directors of the Irish Veterinary Benevolent Fund and the members are all volunteers. So we offer two programs. Firstly, a financial support program. This can be accessed via phoning 087 448 1304. And that number is on our website. You can also access the details via our website, www.ivbf.ie. So an example of the financial support program could be maybe a regular monthly income support, possibly one-off payment for a specific purpose, maybe your veterinary council fees, or maybe putting a child through third level education. Sometimes we can help with something like short-term assistance, like a few monthly mortgage repayments. I mean, each application is very individual, will be assessed on the own individual merit. And just to let you know that everything is dealt with the utmost discretion and confidentiality. Second of our programs is our newer program. It's a support program as well. We have funded in conjunction with the Irish Veterinary Council to provide 24 access to the Vet Life helpline. So if anyone is struggling in these financial times, financial and maybe mentally challenging times, please phone 1-800-145-145, and that will give you access to the Vet Life helpline, which is based in the UK, but Irish vets are now welcome under that phone number to contact them. So follow-up counselling, if required, will be provided by March on Stress. Again, everything through the UK Vet helpline Vet Life helpline is absolutely confidential as well. So finally, I just would like to thank the Irish Veterinary Council, Veterinary Ireland and Vet Support Ireland for their support in setting up the Wellbeing programme. If you need any of those phone numbers, or if you want to look at us in any detail, please look at the Irish Veterinary Benevolent Fund website, which is www.ivbf.ie. And thank you all for listening.
Hi, my name is Rachel Brown, and I'm a mixed practice vet from working over in County Mayo. I've been asked by the VCI to talk about mental health from the perspective of a vet in practice, and some of the tips I've picked up over my career. I qualified back in 1995, and as a new graduate, my biggest aim was to protect myself. I knew I had limited experience in practice, and I knew I also wanted to stay in practice and have a long career. My tip for new grads is when you go out to a call, give it 100% of your time and your energy. Then have a review when you go home, but don't worry. I never worried too much about, did I do this right? I'd never forensically analysed what I did on the call or the consult until I had to either review the animal or there was a further issue. It's really not important. It's really important to not take on too much pressure when you're a new grad. Yeah, you have the knowledge, but you just may not have the context for that knowledge or have the physical skills to be quick and as efficient as you see the other vets around you. So as a new grad, back in 1995, it was much easier. We didn't have social media. And as someone said recently, a picture on Instagram is 1 second out of about the 89,000 seconds there is in someone's day. So just to remember, try not to compare yourself to everything you see on Instagram, because I mean, I do the same. You only show the successes. We never show where things have been difficult, the failures, and anything like that. And also, you're not an expert when you qualify. I'm still not an expert. So just know your own limits, but still try to improve. Try to push yourself on that little bit, because it's very easy once we get over the starting out in practice and we try to do our best. It's very easy to get into a little rut, and we need to then not stay at this plateau. We want to push ourselves forward a little bit. Obviously, 1995 was a long time ago, and I've come up with different ways of trying to cope with what is a very stressful profession. As vets, we want, and nurses, as vets and vet nurses, we want to do the best for our clients. We want to do the best for the people we work with. And sometimes we forget to look after ourselves. And also there is a lot of pressure on us for a work-life balance, get the most out of your day. So for me, I actually look on it as a life balance. So I try to get enjoyment from, not just from the times I'm not working, but from the time I'm working. When I'm at work, I try to be present, to be there. I try to enjoy my job as much as I can. Now, at this time, veterinary practices are extremely understaffed. This is making us very busy, and this is leading to stress. But there's some things that I do during the day. I make sure that I take my breaks. I make sure that I have my scheduled lunch. I make sure that I'm eating regularly, because as anybody who works with me knows, being hangry is not a good thing. And if at all possible, especially in small animals, try to get out of the practice. Try to maybe take a walk or a little bit of exercise. I find it really important, if you're constantly focusing on my fun starts at 6 o'clock tonight or when I finish, I think you're losing a lot of what we can have during the day, because being a vet or a vet nurse is a fantastic profession. So in a vet practice, vets, vet nurses, animal care assistants, receptionists, we all work together, and we have to treat our colleagues with respect. As a vet, we may have, for example, a fixed number of operations to do in the day, and we may decide we're going to plow through these until we finish at maybe 3 o'clock. However, the receptionist and the veterinary nurse or animal care assistant and other people that are helping you, they have a very fixed lunch break. So by you deciding to work all the way through, you may mean that they don't get their break, which just adds to the pressure of working in a veterinary practice. So in practice, I'm in the lucky position to be one of the owners. This gives me great autonomy over what I do during the day. Obviously, not everything in veterinary goes as planned, and we just have to be ready for when our day everything disintegrates around you. I find that trying to be as prepared as possible for everything that I do can help me focus and get through the many tasks that I have. For example, as a young vet, you may not know exactly how to do a certain procedure, for example, as quickly as the other vets in the practice. But if you learn from the nurses and the other vets about the setup towards this procedure, how you can improve your efficiency around it, this will make the day run much smoother and should relieve a little bit of the stress on you. Now, as I said before, I'm no expert, and I've been qualified since '95. I love my job. I love what I do. And I would love if all vets could thrive in practice. We can't be just surviving. We have to grow. What has helped me an awful lot is being involved in activities out of practice relating to veterinary. I volunteered with the Clinical Society, Veterinary Ireland. I'm representing vets on the Veterinary Council. And I think these outside interests, with these, you can help improve the profession. There's an awful lot of stress and anxiety around the profession. We have a massive recruitment and retention issue. And I mean, this is a fantastic profession. We go out, for example, I go out onto a farm I do a cesarean section on a cow, I bring new life into the world. But unfortunately, we don't remember the really positive outcomes. We can fixate on the negative outcomes. And sometimes things just go wrong. This is the art of veterinary medicine. This isn't science. It is not X plus Y does not equal Z every single time. Sometimes you get a unicorn. So we have to be prepared for that. And every day, try to find that little thing that brings you a bit of joy. Try to do that little thing for yourself that, yeah, I had that fantastic lunch by the beach. Or I solved that little dog's problem. I fixed that cow. I passed that stomach tube in the calf for the first time by myself. Look for the joy. Try not to focus on the things that go wrong. And try not to compare yourself to what other people do. Yes, chat to your friends. That is the one thing with COVID. People haven't been able to go and visit their friends and have a good chat. All they see is what they see, the pictures up on social media. And that is not always the true story. But talk to people and never be afraid to approach the vets you work with, the vet nurses, your employers. If you're having an issue, tell us. We will do everything we can to help. Your rota, etc., can be modified. And as previous speakers in this webinar have said, there are many supports available. We want a veterinary profession that is going to be there in the next 10 to 20 years. I want to know that vets in the future will have as much fun and enjoyment in their job that I get every single day. Thank you.
Hello, my name is Eilish Ní and my background is general practice. I'm the Deputy President of the Veterinary Council until the end of December 2021. And I would like, in the first instance, on behalf of the Council, to thank all the wonderful contributors to this webinar, which the Council has put together in order to support and assist vets and vet nurses who may feel they're having a struggle with anxiety or distress, or who may suspect that a colleague or client is in trouble. In my professional experience, I think it's really important to seek help or ask for help early before a small obstacle becomes an insurmountable one. And the time really to prepare for how you might manage if you did find yourself anxious or in distress is when you're perfectly well. So we have heard earlier on in this webinar about the importance of having good habits, whether that be in your diet, in your physical exercise, in your allowing yourself enough time for sleep. All those habits are put in place when you're well. The other thing to think about during that time also is, if you were in distress, who would you speak with? And it would be important that you would recognise a family member or a friend or a colleague or your general practitioner, that you know who you would reach out to for help. I've concentrated in this opening couple of minutes on what you need to do to take care of yourself, because you know the old expression, you can't pour from an empty cup. Unless you are in a good place yourself, you're really not going to be in a good place to provide support to your colleagues or good services to your clients. So anyone can have a difficult consultation with a client, but if every consultation is difficult, then that could be a signal to you that you need to step back and mind yourself, take a bit of care and be proactive about your mental health. So taking that approach, you can apply some of the same approaches if you suspect that a colleague or a client is struggling a bit. Again, the time to prepare for that conversation is in advance of when you might find yourself in that situation. So give some thought to how do you open that conversation. And we all have our own conversational styles, so it's not for anybody to lay out a specific question, as it were, but something open and easy like, and how have you been these times? Or are you doing okay? And the most important thing then is to pause a little bit and to give the person an opportunity to speak to you if they wish. So it's important to develop healthy habits at a time when you're well, and it's also important to take some time out of a busy, caring professional life for yourself to do something that gives you joy, whether that's walk the dog or go to the races or meet friends for a meal or a coffee within the pandemic restrictions that apply at any given time. But you really, it sounds so simple, but it's really important that you do something for yourself, something that gives you joy. We are none of us indispensable, and if you feel that life is becoming too much of a struggle, it really is important to take a step back and to talk to somebody. So sometimes the most difficult thing is to take the first step, whether that's in seeking help for yourself or whether it's in opening that conversation with a client or a colleague around their distress or their issues. We are none of us indispensable, and I think it's important that we take care of ourselves first, and then that we take care of the people around us. And it's only when we do that that we can have a fulfilled professional and personal life. Again, thank you for watching this webinar. I hope that you've gotten some good, practical, pragmatic tips out of it. And can I direct you to the resources that are available for vets and vet nurses on our website.